The topic of the tutorial is deep structures of the neck. I, Dr. Alpana Kesar, will be covering this topic under the following subheads: thyroid gland, styloid apparatus, joints of the neck, namely Atlanto-occipital joint and Atlanto-axial joint. Thyroid gland. Location of the thyroid gland. This is the thyroid gland. It is located in the anterior part of the neck below the thyroid cartilage. This is the thyroid cartilage. It is present in the visceral compartment of the neck, surrounded by pretracheal layers of cervical fascia. The compartment also includes pharynx, trachea, and esophagus. The two parts of the thyroid gland are the two lateral lobes and an isthmus that connects the two lateral lobes. Capsule of the thyroid gland. Thyroid gland is enclosed by two layers or capsule. The inner one is called the true capsule and the outer one is called the false capsule. True capsule is formed by condensation of the connective tissue of the thyroid gland, while the false capsule, which is the outer capsule, is formed by the pretracheal layer of the deep cervical fascia. The false capsule is thickened on the inner surface of the gland to form the ligament of Berry. Through the ligament of Berry, the thyroid gland is attached to the cricoid cartilage of the larynx. As a result, the thyroid gland swellings move up and down on deglutition because of the attachment of the thyroid gland to the larynx. There is present a dense capillary network deep to the true capsule. So, at the time of thyroid surgeries where thyroid gland has to be removed, the gland must be removed along with the true capsule to prevent the capillaries from tearing and leading to extensive hemorrhage. Relations of the thyroid gland. This is the apex of the thyroid gland, which is related to the oblique line of the thyroid cartilage. To the oblique line of the thyroid cartilage is attached the muscle sternothyroid. The base of the thyroid gland is related to the fourth and the fifth tracheal rings. This is the anterior border of the thyroid gland, which is related to the anterior branch of superior thyroid artery. The superior thyroid artery divides into anterior and posterior branches, where the anterior branch runs on the anterior border and the posterior branch runs on the posterior border of the thyroid gland. The posterior branch of superior thyroid artery that runs on the posterior border anastomoses with the inferior thyroid artery. Also on the posterior border is present the parathyroid gland. The lateral surface of the thyroid gland, which is this, is related to the following muscles: sternohyoid, sternothyroid, superior belly of omohyoid, and the anterior border of sternocleidomastoid muscle. This is the posterolateral surface of the thyroid gland, which is related to the carotid sheath. Within the carotid sheath is present the internal carotid artery, the internal jugular vein, and vagus nerve. All these structures forms the posterolateral relation of the thyroid gland. The medial surface of the thyroid gland, which is this, is related to two tubes, that is trachea and esophagus, two muscles, that is inferior constrictor and cricothyroid, and two nerves, that is external laryngeal and the recurrent laryngeal nerves. These are recurrent laryngeal nerves. Recurrent laryngeal nerve. Recurrent laryngeal nerve, which is closely related to the thyroid gland, forms a clinically significant relation to the thyroid gland. This is the right vagus nerve and this is the right recurrent laryngeal nerve. This is the left vagus nerve and this is the left recurrent laryngeal nerve. The right recurrent laryngeal nerve arises from the right vagus and then it loops around the right subclavian artery to ascend up, while the left recurrent laryngeal nerve arises from the left vagus nerve and it loops around the arch of aorta and ascends in the neck. The recurrent laryngeal nerves ascend in the groove between trachea and esophagus. This is trachea and this is the esophagus which has been cut to expose the trachea and the recurrent laryngeal nerves. Thereafter, the recurrent laryngeal nerve pass medial to the thyroid gland related to the medial surface of the thyroid gland, and then it enters larynx. Blood supply of thyroid gland. Thyroid gland has a very rich blood supply like any other endocrine gland in the body. This is so because the endocrine glands pour their secretions into the blood and so all the endocrine glands are surrounded by a rich and a dense capillary network. Superior thyroid artery is one of the two arteries that supply blood to the thyroid gland. It is the first branch of the external carotid artery. After arising from the external carotid artery, the superior thyroid artery descends to reach the upper pole of the thyroid gland. At the upper pole of the thyroid gland, the superior thyroid artery divides into the anterior and the posterior branch. The anterior branch descends on the anterior border and anastomoses with the anterior branch of the superior thyroid artery coming from the opposite side. The posterior branch of the superior thyroid artery descends along the posterior border of the thyroid gland where it anastomoses with the inferior thyroid artery. Together, these two branches, that is the superior and the inferior thyroid artery, forms a rich capillary network around the thyroid gland. Inferior thyroid artery. Inferior thyroid artery, which is this, is a branch of thyrocervical trunk. This is the thyrocervical trunk. And thyrocervical trunk is a branch of first part of subclavian artery. The inferior thyroid artery ascends to reach the lower pole of the thyroid gland where it passes further upwards on the posterior border of the thyroid gland. Here, the inferior thyroid artery will anastomose with the posterior branch of the superior thyroid artery. The inferior thyroid artery mostly supplies the lower part of the thyroid gland and the superior thyroid artery mostly supplies the superior part of the thyroid gland. Together, they participate in formation of a rich capillary network around the thyroid gland. Thyroid ima artery is an artery which may be occasionally present. It is a small artery that arises from the brachiocephalic trunk and contributes to the blood supply to the thyroid gland. It ascends on the anterior surface of the trachea to supply the thyroid gland. Venous drainage of the thyroid gland. There are three veins that drain blood from the thyroid gland, and they are the superior thyroid vein, the middle thyroid vein, and the inferior thyroid vein. The superior thyroid vein drains blood from the area which is supplied by the superior thyroid artery. The middle and the inferior thyroid veins drain blood from the rest of the thyroid gland. The superior and the middle thyroid veins terminate by draining into the internal jugular vein. The inferior thyroid veins terminate by draining into the brachiocephalic veins. The lymphatic drainage of the thyroid gland is into paratracheal lymph nodes and into the jugulo-omohyoid group of lymph nodes. Students, don't forget to like this video and subscribe to the channel to stay updated with the latest exam questions. In the clinic, the commonest disorder of thyroid gland is the multinodular goiter, which is diffuse irregular enlargement of the thyroid gland. The typical symptom is diffuse mass in the neck, which moves up and down on deglutition. It can be managed medically. Sometimes the swelling may become so large that it may compress the trachea and cause the respiratory problems. Surgical excision may be done if the mass is so large that it starts affecting the patient's life or cause respiratory problems. In most cases, it usually involves excision of a part or most of the thyroid gland, leaving behind some of it. The gland is removed along with the true capsule so as to avoid excess bleeding. Care must be taken to preserve the following structures at the time of removal of the thyroid gland, and they are the parathyroid glands, the external and the recurrent laryngeal nerves. During the excision of the gland, the superior thyroid artery is ligated near the gland to preserve the external laryngeal nerve. An inferior thyroid artery is ligated away from the gland to preserve the recurrent laryngeal nerve. Parathyroid glands. These are the parathyroid glands. This is a pair of superior parathyroid gland and this is a pair of inferior parathyroid gland. So parathyroid glands are two pairs of small ovoid yellowish structures on the deep or the posterior surface of the lobes of the thyroid gland. The arteries supplying the parathyroid gland are the inferior thyroid arteries, and the venous drainage and lymphatic drainage follows that described for the thyroid gland. Styloid apparatus. Styloid process with all its attachment is known as styloid apparatus. This is the styloid process. It is a cylinder pointed process arising from the temporal bone. It is directed downwards, forwards and medially. Relations of the styloid process. External carotid artery crosses the tip of the styloid process while the facial nerve crosses the base of the styloid process. It is present between the external and the internal carotid arteries and medial to it passes the internal jugular vein. Structures which are attached to the styloid process are two ligaments, that is stylohyoid and stylomandibular, and three muscles, that is stylohyoid muscle, styloglossus and stylopharyngeus. Styloglossus muscle, which is the muscle of the tongue and is attached to the anterior surface of the styloid process. Stylopharyngeus muscle, which is the muscle of the pharynx and is attached to the medial surface of the styloid process at its base. The stylohyoid muscle is attached to the posterior surface of the styloid process. It is one of the suprahyoid muscles. Stylomandibular ligament is attached to the lateral surface and the stylohyoid ligament is attached to the tip of the styloid process. The origin of styloid apparatus is diverse. The styloid process, stylohyoid ligament, and the stylohyoid muscle is derived from the second branchial arch, and the stylopharyngeus muscle is derived from the third branchial arch. Styloglossus muscle is derived from the occipital myotomes, and stylomandibular ligament is a part of the deep cervical fascia of the neck. Joints of the neck. Atlanto-occipital joint is the most superior joint of the neck. It is formed between the occipital bone and the first cervical vertebra. The articulating bones in the joint are the occipital condyles, which is this, with the superior articular facet, which is this of the atlas. It is an ellipsoid type of a synovial joint. The ligaments of the joint include the capsular ligament, which completely surrounds the joint, anterior atlanto-occipital membrane from the anterior margin of the foramen magnum to the anterior arch of the atlas. The posterior atlanto-occipital membrane, which is this, from the posterior margin of the foramen magnum to the posterior arch of atlas, which is this. The arterial supply of the joint is by deep cervical artery, occipital artery, and the vertebral artery, and the nerve supply is by the dorsal rami of the first cervical spinal nerve. Movements at atlanto-occipital joint. Atlanto-occipital joint allows forward flexion, backward extension, and the lateral bending or lateral flexion. For ease of remembering the action of the atlanto-occipital joint, sometimes atlanto-occipital joint is also known as yes joint, as it allows flexion and extension that takes place at the time of nodding while saying yes. Flexion is brought about by rectus capitis anterior, which is this muscle, and longus capitis. Extension is brought about by rectus capitis posterior major and rectus capitis posterior minor. This is rectus capitis posterior major and minor. Other muscles that participate in extension are obliquus capitis superior, which is this, semispinalis capitis, splenius capitis, and trapezius. Lateral flexion or bending is brought about by rectus capitis lateralis. Along with it, semispinalis, splenius capitis, sternocleidomastoid, and trapezius muscles. Atlanto-axial joint. This is the atlanto-axial joint, which is formed between the atlas above and the axis below. It consists of two lateral joints and one median joint. The lateral atlanto-axial joint is formed between the inferior articular facet of the atlas with the superior articular facet of the axis. It is a plain type of synovial joint. The ligaments of the joint include the capsular ligament, which surrounds the entire joint, anterior longitudinal ligament, and ligamentum flava. Median atlanto-axial joint. The articulating bones in the median atlanto-axial joint are the dens of axis with the anterior arch of the atlas anteriorly and the transverse ligament posteriorly. It is a pivot type of a synovial joint. The ligaments of the joint are the capsular ligament that completely surrounds the joint cavity and the transverse ligament which is present behind the dens. The movement that takes place at the atlanto-axial joint is rotatory movements around the vertical axis, For ease of remembering the movements at the atlanto-axial joint, it is also called a no joint as it allows rotation of head as that occurs while saying no. Questions that may be asked in the examination from the topic of the tutorial are relations of thyroid gland, capsule or coverings of thyroid gland, blood supply of thyroid gland, applied anatomy of thyroid gland, parathyroid gland, styloid apparatus, atlanto-occipital joint, atlanto-axial joint.